Best technique to answer surgical grand rounds questions. Welcome to the Everything Surgery podcast, where today we explore the most effective strategies for excelling during surgical grand rounds. Answering questions in this setting demands more than simply recalling facts. It requires showcasing the clinical reasoning and thought process that distinguishes an experienced surgeon. In this episode, we will present a comprehensive approach to mastering surgical grand rounds questions. This technique is divided into two main components: thorough preparation before rounds and a structured method for responding when you are called upon. The core philosophy: see one, do one, teach one. For thinking aloud, the primary objective is not merely to provide the correct answer. Instead, it is essential to illustrate a safe, logical, and evidence-based clinical reasoning pathway. During your response, you should verbalize your thought process, mirroring the approach of an attending surgeon. Phase 1. Preparation before rounds. Genuine understanding cannot be fabricated. Preparation should be systematic, focusing on recurring question styles commonly encountered during rounds. Master the differential diagnosis framework. For any presenting complaint, such as pain localized to the right lower quadrant or obstructive jaundice, be capable of listing potential diagnoses in order of frequency and severity. Group these diagnoses. For example, distinguishing between surgical and non-surgical causes or between intestinal and hepatobiliary conditions. Be familiar with landmark clinical trials for prevalent diseases, including those affecting the breast, colon, pancreas, and in cases of trauma, know the pivotal studies that inform modern treatment guidelines. For example, when discussing breast cancer, be ready to elaborate on the National Surgical Adjuvant Breast and Bowel Project B06 trial and the American College of Surgeons Oncology Group Z0011 trial. Understand both the conclusions and their impact on clinical practice. Understand standard management algorithms. Prepare to walk through established treatment protocols. For example, the typical structure includes initial resuscitation and stabilization, diagnostic imaging, making decisions regarding surgery or conservative management, outlining operative techniques, and planning post-operative care and follow-up. Anticipate case-specific questions. If the discussion centers on a particular procedure, such as a pancreaticoduodenectomy for pancreatic cancer, review relevant anatomy, operative steps, and common post-operative complications, such as delayed gastric emptying or pancreatic fistula. Phase 2. The STAR technique for answering questions. When the moderator directs a question to you, use this structured method to organize your thoughts and convey a clear, methodical response. Stop, pause, and paraphrase. Resist the urge to answer impulsively. Take a brief moment to compose yourself, demonstrating poise under pressure. Repeat the question back to the moderator, confirming your understanding and allowing yourself a moment to think. For example, thank you for your question. If I understand correctly, you are asking about my management of a patient who is hemodynamically unstable with a significant liver injury following blunt trauma. Think aloud using a framework. Step 1. Assess and resuscitate. Begin with the patient's stability, which is fundamental. State your commitment to advanced trauma life support principles, securing the airway, establishing intravenous access, initiating a transfusion protocol, and performing a focused assessment with sonography for trauma. Step 2. Narrow the differential and make the diagnosis. Outline diagnostic steps based on the patient's condition. If the patient is transiently stable, proceed with computed tomography imaging to grade the injury and identify other potential injuries. If instability persists, emphasize the need for immediate surgical intervention. Step 3. Discuss management options. Present balanced management options, highlighting indications and contraindications. For a severe liver injury, explain the choice between angioembolization and surgery. If the patient is stable, discuss the rationale for monitoring in an intensive care unit with serial examinations and hemoglobin assessments. If transfusion requirements remain high, recommend surgical intervention. Step 4. Detail the operative plan. Provide specifics about the surgical approach, including incision type, anatomical landmarks, and procedural steps. For example, describe performing a midline incision, packing all quadrants, employing a Pringle maneuver to control bleeding, and considering perihepatic packing with a planned second look operation. Anchor your answer with evidence and first principles. Reference authoritative guidelines, such as those from the World Society of Emergency Surgery for Liver Trauma, or discuss grading scales that guide management. Explain relevant anatomy and physiology. For instance, clarify the rationale behind the Pringle maneuver, which helps differentiate sources of bleeding. Address potential complications, such as the risk of rebleeding, abdominal compartment syndrome, or biliary leak in the postoperative period. Return and summarize. Conclude your response by directly answering the original question. For example, to summarize, my management of an unstable patient with a severe liver injury would be immediate transfer to the operating room for surgical intervention, followed by intensive care and a planned second look. Common pitfalls to avoid. Avoid oversimplifying. Do not merely state that you would operate. Always explain the reasoning behind your decision. Avoid rigidity. Recognize that management decisions are nuanced. Use thoughtful language that reflects adaptability, such as my approach would be guided by the specific clinical circumstances. Avoid bluffing. If you are unsure about a detail, it is preferable to admit uncertainty and rely on fundamental principles rather than provide a potentially inaccurate answer. Avoid overlooking the patient. Ensure your response considers patient comorbidities, preferences, and quality of life. Clinical reasoning should always center on the individual patient. By combining thorough preparation with the structured STAR response framework, you will not only answer questions accurately but also demonstrate the composure, safety, and intellectual rigor expected of a future surgical leader. Thank you for joining us, and best of luck as you prepare for your next surgical grand rounds. If you enjoy our content, please like, share, and subscribe. This is the Everything Surgery Podcast, where we dissect the extraordinary.